Hi there, I'm Wendy Warren Grapentine with Group Health Cooperative, and I'm here today to talk to you about a tool that you can add to your toolkit for dealing with low back pain. This tool is called Meridian Tapping or Emotional Freedom Techniques, and it's something that you can do anytime that you're experiencing pain, and it's designed to be used in conjunction with all of the other tools and treatments that you've gotten from your GHC providers. So let's jump right into how to do it so that you can come back and work with this in the future, and then once I'm done showing you how to do it, I'll explain on the back end a little bit more about why it works, how it's so effective. Okay, so let's jump right in. The first thing we're going to do is identify the pain that you're feeling. Very specific. Where is it? What does it feel like? How do you feel about it? And assign it a number. 10 is most intense, 0 is least intense. So let's say we have a number 8 level back pain in my low right back in towards the spine, just above my hip bone. All right, so we're going to begin by tapping on what we call the karate chop point. This is that fleshy part on the side of either one of your hands. It doesn't matter which one you use, and you're going to tap on it and essentially just talk about the problem. So describe what's happening, and we begin it with, even though I have this number 8 level back pain and it really hurts. It feels so intense, it's pinchy, it's just exhausting me. But I'm okay and all is well. We repeat that at the end of each round. Now we do this 3 times. So again, even though I have this back pain issue, it is in the low right side of my back. It feels like it's pinching and poking, kind of even a burning sensation right now. And it's really exhausting to me. It's constant. I'm frustrated, but I'm okay and all is well. And now a 3rd time. Even though I have this back pain problem right now, it feels like a number 8 in terms of intensity, and it's in that low right side. I can feel it right now. It feels like someone's reaching in and just poking it with a red hot poker. But I'm okay, and all is well. Now that we're done with the setup, we're going to move and tap on each of the points. So at the beginning of your eyebrow, right where your eyebrow begins, take 2 fingers and begin to tap there. Well, you either continue to talk about the problem or repeat a reminder phrase like, this low back pain. Now come to the side of your eye, right on the bone, not out on the temple, but on the bone in the corner of your eye, this low back pain. Underneath your eye on the bone, right here in the center of your eye, this low back pain. When you feel compelled to take a deep breath, please do. That's your body talking to you. Now come underneath your nose and above your lip. This pain in my right low back, it's so intense. Underneath your chin in the little ridge here. This pain in my low back. Now we're going to come to the knobby parts right in the hollow of your throat, coming out to the side. There are 2 knobby points. You can tap on one or both. This intense low back pain, it's been with me so long and I'm so exhausted by it. The next point is going to be underneath, if you come from your elbow down about 3 inches, right in the center. For women, it's in the middle of your bra strap. Just tapping right there with your thumb. You could also reach across if you'd like and tap on the other side, whichever feels more comfortable. And again, a reminder phrase or continue talking about the problem. This number 8 low back pain that is pinching and tight and is exhausting me. Top of your head, right in the middle. This low back pain. It makes me feel so exhausted. Now let's go back through one more time, a little more quickly. This low back pain. It's with me so often. It's keeping me from doing the things I want to do. It's really painful. It's emotionally exhausting. I can't do the things that I want to do. I don't like feeling weak. I don't like dealing with pain. Deep breath. Let's go through one more time. This low back pain. It feels like a pinching, pulling in that right side of my back. It feels so intense. It makes me feel weak and angry. I don't like having this pain. It's so frustrating. It's so painful. This low back pain. This number 8 low back pain on the right-hand side. It's just too much. Now come back and do your insides of your wrists, right here. Tap those together and just pause. And now be still and take a nice deep breath. And then assess the pain. So we started at an 8, and maybe now it's come down to a 6, maybe even lower. It kind of depends. If it's come down enough that you're feeling enough relief, you can be done. If there continues to be some pain, you can repeat the process. So you come back to the setup. Even though I continue to have this back pain, it feels like a level 6 in intensity. It's getting a little better, but it's still getting in the way of me living my life. But I'm okay, and all is well. Repeat it a second time. Even though I have this continuing low back pain, it's an issue. I'm ready to be done with it. I feel like I'm doing everything I'm told to do, and it still hurts. When is this going to go away? But I'm okay, and all is well. And now the third time. Even though I have this low back pain on that right-hand side, it's down to a 6, but it's still there. But I'm okay, and all is well. And now we come back and tap again. This time I'm going to go on the other side, just to mix it up. Doesn't have to be that way. This low back pain, again, the beginning of the eyebrow, it feels intense. It's improved a little bit, but not enough. This low back pain is wearing me out. I'm exhausted by it. I can't sleep the way I'd like to sleep. I can't sit the way I'd like to sit. It's hard to stand for long periods of time. This back pain, it's a pinching feeling, poking, burning. It's so intense, and I'm so ready to be finished with it. I just want some relief. I've been trying everything, and it's still hanging out, this low back pain. Come back to the wrists. Pause, take a nice deep breath. And assess the pain. Now, oftentimes I find that I'll feel like I need to stretch or move, especially with low back things. Like when I'm doing that last breath, sometimes I'll just want to take a nice deep stretch, or if you're sitting down, stand up and move around a little bit as you take a breath. You may even feel like you want to do some movement as you're doing the tapping. If your body is inspired to take action in terms of a stretch or wanting to take a deep breath, listen to that. That is your system, your energetic system talking to you and showing you how to release some of the tension and the pain that's causing a problem for you. So listen to those cues. They're really kind of exciting, the way that your body communicates with you. Okay, so that's how you do it. We did several rounds. You notice that I switched from one side to the other just to show you that you can. I tend to do it usually with my right hand tapping on my left, and then on the right side of my body, I'm right-handed. That's probably why. It really doesn't make any difference. A couple different things to understand how and why this works and how you can use it, okay? So what we're doing is we're tapping on the energy meridian. So each of these points that we're tapping on are the beginning or ending point, or just a very easily accessible point along the energy meridians in our body. These are from traditional Chinese medicine. If you've ever been to an acupuncturist or you know anything about acupuncture, acupuncturists are working with those Chinese energy meridians to help release blockages in the energy flow in those systems of our body. We have the ability to do it ourselves in a less intense way and sometimes a little more accessible because you can't always get in to see our acupuncture or any acupuncturist, right? It's nice to have a tool in your back pocket that you can use whenever you need it. And so we're just tapping on those points and helping to clear the energy as we move our way through, okay? Simple. We do them in this order only because it's just an easy way to remember how to do it. If for some reason you forget one of the points, you skip over it, or you do them in a different order, not a big deal, truly. Please don't let the perfect be the enemy of the good with this. You're better off just giving it a shot and seeing what it does, okay? I learned this tool and I spent 2 years not using it as much as I could because I was so afraid of not doing it right. I'm like, oh, I don't know exactly what to say, or yeah, I had it all worked up and made it difficult. And then when I finally just said, I'm just going to try this, I was amazed at how much it worked for me and how quickly. So the idea behind it and why meridian tapping, so it's tapping on the meridians, but it's also known as emotional freedom techniques because it's really was originally designed to help release the emotional connection that we have in our bodies to the pain. So you heard me talking through our little routine there about some of the emotional hurt that I was experiencing because of low back pain. That's really a real thing when you are dealing with physical pain. You have the physical pain, but you also have emotional pain that goes along with it, and they're so intertwined. This is the area that I work in as an energy worker and a massage therapist, is that mind-body connection. How do the things that happen in our mind connect in and show up in our bodies? And I love to educate people on here's how it shows up and here's what you can do to help to shift it through your own body. So we're working with the Chinese energy meridians. We're tapping on those points to release the energy blockages. And the reason we do this setup here at the beginning is just to the analogy that I was taught that I really like is it's as if you were going to go into a Word document and you want to change something that you've written before. You can't just open up your computer and start typing, right? You have to turn on the computer, you have to open Word, you have to go find that document, then you need to highlight the section you want to change, and then you can go change it. Well, everything all the way up to that highlighting point is what we're doing with this setup. We're saying, hey body, we want to shift this. This is what we want to focus on. So that's why it's really important to get very specific about where the pain is, how it feels physically in your body, and then often emotions will come up somewhere in the process. So emotions may not show up right away. Focus first very specifically. It's going to work best for you if you focus specifically on the area of the body where you're feeling the pain and the type of pain that you're feeling and the intensity of it. Then you'll notice after the first couple of rounds of tapping through, you might start to be present to how that pain is making you feel in terms of the limitations, the time that you're having to put in to deal with it, all of those things. And studies have shown that using meridian tapping can reduce the pain significantly because a large component of it is tied into the impact that pain has in our lives, the emotional pain that it causes us, the frustration, and all of that. So it's a wonderful tool. It has made such a difference for so many of my patients and for me personally in my own body. I don't deal with low back pain per se. I have a spot in my right hip that it feels like somebody's going straight into the side of my hip toward the base of my spine and then like twisting. It gets really tight and really painful to the point where sometimes I haven't been able to walk. And I quickly learned that it was my body's stress response. And so I can go and do this tapping and go from an 8 to a 2 in just a couple of rounds. And it freaks me out and surprises me every time. I don't know why it does because I know it works, but it's just such an amazing thing sometimes. So, low back pain can often be quite complicated. Lots of different things going on. I'm in no way trying to say that it's all in your head or it's just an emotional thing. You have very real things going on, and it's important to work with your primary care provider and other specialists and PT and OT and all those wonderful folks too, and all the tools that they're giving you. This is just one more thing that you can consider and add in as you're on your low back pain journey. So I hope and believe that you can find some relief through all of the tools that you're receiving here from us at Group Health Cooperative. And I would be happy to work with you in an individual session. We are doing them online right now because of COVID-19, but also eventually in person But this is a great tool that we can do via a Zoom call and do a one-on-one session. So please try it yourself. It's designed for you to do on your own. But I'm also happy to support you with a session, a mind-body session, and we can look at that and I can coach you along with that. All right, so good luck to you on your journey, and thank you very much for spending time with me today. Take care.